Hi, my name's Jasmine Foster. I'm an Anishinaabe Nish Manitowoc living in Lac Seul First Nation in Ontario.
Hi, in this video I'm going to give you a short introduction into chiropractic and what it means to you and your health.
And I've been a client of Dr. Craig's now for about a year. His chiropractic care has helped me significantly, my healing journey.
Back on the 18th of September 1895, a healer called Daniel David Palmer was working in his office. This is D.D. Palmer here, as he was known. And he was working with a man who worked in his office, Harvey Lillard. Now, Harvey had been a janitor in the office. Harvey had also been deaf for 18 years. So Palmer asked him, how did this deafness occur? And he explained that he was working in a stooped, cramped position. He had something go in his neck, he had a buzzing in his ears, and he couldn't hear properly. So Palmer rationale that if something went in his neck and his hearing went, maybe if he corrected the problem in his neck, maybe his hearing would come back. And he managed to convince him to let him adjust him on 3 separate occasions. And then when you remember, chiropractic didn't even exist at this time, so it was a completely new concept. It was obviously some good salesmanship on D.D. Palmer's part. And anyway, on the 3rd adjustment, Lillard's hearing came back. So Palmer realized he discovered something. Initially thought it was a cure for deafness, but then later on he realized, after having a woman's serious heart problems reduce and a guy's indigestion reduce, he realized that he'd actually discovered something different, and that's how chiropractic care was born.
I've had a lot of accidents. I had 2 traumatic brain injuries and 16 concussions over my lifetime.
Now, I'm going to talk about my definition in a second, but really I'm going to dive into this book, which is called The Science of Chiropractic. It was written back in 1906. It was written by D.D. Palmer, primarily, who was the discoverer of chiropractic, and his son B.J. Palmer, who evolved chiropractic. And under definitions, right at the beginning, it talks historically. Chiropractic was discovered by D.D. Palmer in September 1895. The Palmer School of Chiropractic has developed it into a well-defined science that has no resemblance whatever to any therapeutic method. Therapeutic method means diagnosing and treating symptoms and disease. So right at the beginning, chiropractic was defined as not being the treatment of any sort of symptom or disease. And defined chiropractic as the science of cause of disease and art of adjusting by hand all subluxations of the 300 articulations of the human skeletal frame, more especially the 52 articulations of the spinal column, for the purpose of freeing impinged nerves as they emanate through the intervertebral foramen, causing abnormal functions in excess or not enough, named disease. We are well when the innate and educated nerves are free to act. Disease is abnormal function. Diseases are but the result of impinged nerves. 95% of these are caused by vertebral subluxations, which impinge nerves. So, my name is Dr. Craig Hindson. I am your chiropractor in Ottawa. So we've just heard what D.D. Palmer defined chiropractic as, and he obviously is the man. Now, they couch that in language of the 19th century, the early 19th century. And myself, I've been under chiropractic care now since 2001, so that's 24 years at the moment, okay? For 8 of those years, I was a patient, so I wasn't a chiropractor. I was under care as a patient in an office in England. And then for the following 9 years, I worked as an office manager and an assistant to the chiropractor. And then now for the last 9 years, I've been a chiropractor myself. So I've seen chiropractic from lots of different angles. I've explained it probably 600 times in 600 different lectures. So I have a pretty firm grasp, and also I've witnessed it in office because I practice. I've seen the healings happen. So I've got a pretty dash darn good idea of what chiropractic care is. Okay, so let's go. I am a first principle chiropractor. I go back to the principle that D.D. Palmer talked about, which is that you have an innate intelligence in your body. In fact, every living organism has an innate intelligence, and that is individual to that organism. And the intelligence works on that organism's very best behalf. So all human beings have an innate intelligence. And Palmer talked about disease occurring when there was an interruption to the expression of that correct innate intelligence. So we have an innate intelligence, which is the body's inborn intelligence, which we're born with and knows how to run the show. And then we have an educated intelligence, which is programmed over the years with information we pick up from various sources. Some of those sources good, some of those sources not so good, okay? So there is a limitation to educated intelligence. In society today, we highly prize educated intelligence, more so than innate intelligence. So what that means is we're actually focusing on flawed information or flawed expression in the body, whereas within your body you have innate intelligence, which is perfect. It's been running the body for 350,000 years, so it's got a pretty good idea of what it's doing. Now, if there is an interference to that innate intelligence, that is when disease and infirmity starts to set in. And as Palmer defined in his original book, impinged nerves lead to an interruption in the expression of that innate intelligence. I am what's called a first principle chiropractor. The first principle is you have an innate intelligence. I always practice from that mindset that your body is a miracle. It is 100% competent. It knows how to adapt. It knows how to heal. It knows how to replace aberrant cells, and it knows how to grow fully functioning healthy cells. Okay. The question then becomes, what has happened to prevent that? And in my experience, it's interference. And as a chiropractor, I use my hands. Chiropractic means done by hand. I also occasionally use some adjusting tools to make an adjustment. Adjustment is when I check the spine. I find imbalance in the spine. Muscles give me indications, nerves give me indications, and the structure gives me indication of where these imbalances are. Okay, and if you want to come with me, now we've had a little quick introduction. This is what I'm talking about. This is the nerve map. Okay, so you've got the brain at the top. The brain extends down into the body, and it has the spinal cord, and it is protected by a bony tube, which we call the spine. The spine, whilst it's awesome to help us play rugby and football and all those really cool things, go out dancing, the main reason it exists is to protect the brain as it extends into the body. And as you can see, if there's an imbalance in the spine, it can conceivably put pressure on those nerves. Those nerves go everywhere in the body. 10% of the nerves are feeling nerves, so that means a whole whopping 90% are function nerves. Of that 90%, half are muscle function and the other half are organ function, and the organs are illustrated there in a kind of fun way. So in other words, you can have pain in your mid-back, or maybe no pain. You can have pressure in your mid-back on the nerves, changing how the stomach is functioning. You have no pain, no indication, but the function of the stomach changes. You get acid reflux or maybe stomach ulcers. And it's only when finally you get some sort of pain, because the 10% of nerves get hit, you go see a chiropractor. The chiropractor works on the spine. You want the pain to go. That makes sense. The chiropractor wants you to have better function. That actually makes more sense. And then after a while, the pain goes, but also you notice that you're not getting as much acid reflux. So that's just one example. Obviously, examples go on and on and on.
You know, back in the day, we would have went and saw our elders and our medicine folks to, you know, fix these issues and help us live in a good way. And, you know, we don't have access to a lot of those teachings anymore.
Okay, so that is chiropractic. Okay, my name's Dr. Craig. As I said, up there I'm going to put another more in-depth video, and I trust that's been of interest. If it has, go down below, boop the like, spank the subscribe, ding the notification bell to all, and the next time I drop a video, you'll be amongst the first to get notification.
So chiropractic has been something that's really been useful for me, healing my body, my bones, my muscles, how my body functions, to feel good, to feel less pain, to have better sleep, to have good energy, to wake up in the morning and do the things we need to do for our community and for our families. So if you're considering bringing chiropractic into the community, I would highly recommend letting Dr. Craig come and help you make a much.